George Lawlor is my name. I'm currently Cathaoirleach of Wexford County Council. I've made a few notes on the phone here. Great to see you, Kathleen. Little did we think when we were sucking tea back in the day in Siptu that we'd be here at a meeting of this nature. The sad news for you is Brian Cody has just resigned. It's great news for everybody else. But welcome to Wexford to both of you. Jamie said a couple of, in her address, said, people with very little lived experience on the ground making decisions here. That's why I'm delighted to be here today, because luckily for me, I have that very little lived experience on the ground. And that's why I think meetings and gatherings and afternoons like this are extremely important to educate us who are supposed to be decision makers, are supposed to be in a situation where we make the decisions or we make the policy. And I think you outlined simple policy changes that would make such a difference to the people who we speak about here this afternoon, children and adults with additional needs. And I think the notion, as you've outlined, particularly your cousin with epilepsy. Sorry, her cousin, sorry. What you described there is a nightmare that can be resolved simply. And I think that's what we're about. The problem is, and it's not just policy, I think, Kathleen, I think it's ideology. Because it's not just the government of the day, it's the ideology of much of the civil services that we're trying to back as well. Back in the day when 3,000 beds were taken out of the system, the public system, so we could create Whitfield and the Beacon Hospital and things like that were profit driven. That it crosses all parts of the health spectrum. Where is the money going to come from is often the question. I would suggest if we stop peddling the notion of tax cuts and invest in our services, I think we'll be doing a good day's work. And this whole populist notion that tax cuts are what people are crying out for, because I think the average, ordinary, decent person in Ireland would rather see the money go into services so we're not standing here today than have an extra 10 a week in their pocket. I speak for a lot of ordinary people, ordinary taxpayers, who would rather see the services invested in so that children and adults with additional needs could be looked after in the proper way that is required. As regards to recruitment in the HSE and the difficulties of retention, my daughter's she's a nurse in Cork. She wants to transfer to Wexford. Wexford General Hospital had these big signs, we're recruiting. She applied, yeah, but we're not recruiting you. She has a first class honours degree in nursing, or we're not recruiting in your area, you're general nursing. I have another daughter who was studying occupational therapy in Edinburgh because she got 570 points in her leaving cert last year, and there was no place in Ireland because the points for occupational therapy went above 600. So to attract people in, she'll probably stay in Scotland. There's no notion that the across-the-board services want to have a kind of a unified front. And you spoke about getting some of the therapies into secondary school. We're actually forcing people out of the country who want to actually stay here and be part of it. There's a culture of protectionism in the HSE. All they want to do is circle the wagons and make sure that they're not exposed or not put on the hazard. I'm a proud founding member of the Collective Sensory Group, Amy, and I'm involved in the Dream Big project, although it is these people here who do all the work. We sort of tick the corporate governance box. Councillor Pat Barron is also involved as well. Just to give you an example, Shona and myself were on the radio talking about the paucity and the lack of services and how people were suffering greatly. And the HSE's response was to haul her in to talk about what she had said on the radio. Not about, listen, how can we improve the services? It was what she had said on the radio was out of order, and she was reprimanded for that because we happen to have a HSE SLA, service level agreement. Sorry, I know I'm rambling on, but I just want to Parents, in relation to young people, you are the people on a daily basis on the ground who see what's happening, who know, we always say we know our own child, be that a child with additional needs or a normal child. So parents must be brought to the fore, and not the civil servants who make the decisions to suit the organisation. As I've said, you brought forward, Amy, you mentioned COVID, and it is incredibly frustrating in every sector of the public service when you ring up to inquire about a disability allowance or an adaptation grant or COVID has caused great difficulties. But one of the things I say about COVID is, when it comes to state intervention, when it comes to actually reacting to a crisis, one thing that COVID did and taught us was it can be done. When the world is collapsing around us and the state needs to intervene, COVID taught us that it can be done. So, in many respects, whilst it's incredibly frustrating to listen to this COVID thing being peddled, it also sent out the message that where there is an existential crisis, where something needs resolution, where something needs to be tackled by the state, it can be done. Bernard spoke about private and public. I hate the notion of public services being privatised, but I hate the notion that we have an incompetent public system led by people who have self-interest at their heart also. And that's something I think we need to tackle in the public service if we're not to be forced out of a public system that can be so good. Because yes, the notion that privatisation, we've seen it across the board in our health services, where if you need something tackled, if you're private, you can have it next Wednesday, but if you're public, you can have it in 4 years' time or 5 years' time, if at all. So we need to ensure that our public services step up to the mark as well, because they are not. There are individuals within that who are just not good enough and not performing enough. And that's what we need to do in our public services as well. So just to say, I'm delighted to be here as a public representative. I'm delighted to learn and hear the stories, because we don't live that daily life that you live, and we don't see the challenges as much as we should. So it's essential, and I'm delighted, certainly as Chairman of Wexford County Council, and I'm delighted to see some of my colleagues here today, to be here, to learn from you, and Jamie, you brought forward, and the frustrations from Amy and Bernard, you brought forward some things that can be tackled simply, that don't need the whole world to change for those to be tackled. So thank you very much indeed, and thank you for organising this today. Thank you.